do, now, again, you get tenderness right here, but you can get along the wrist extensors. And this, by the way, part of what makes that diagnosis process kind of tricky. If I have true tennis elbow, I can have trigger points along in here, and so when I push in here, it could be tender. And yet, remember right in here is also where your supinator muscle is, and so that could be tender. So which is which? What's going on? And the way they describe it is, where's the point of maximal tenderness? If it's more tender here, it's more likely a supinator syndrome. If it's more tender here, it's more likely a tennis elbow or an extensor tendinopathy or an enthesopathy, as we described earlier. Now, another way, of course, is to compare both sides, because there's a lot of people just have tenderness right at the radial tunnel. And so, on the side of their complaint, it should be significantly more tender than the opposite side as part of that factor. So we do soft tissue therapies. Now, what we're going to do is, and what else is happening with tennis elbow? When you get scarred, it tightens. And when it tightens, then I'm reaching the point of injury more rapidly. What else happens when you get scar? Fibrotic scar weakens the tissue, and so it tends to tear over and over and over again. And what's the amazing statistic? 98% of tendon tears occur in degenerated tendons. So we want to do things to help strengthen the tendon. Soft tissue therapy is part of that process. You can do cross-fiber friction massage right on the tendon. That's part of the therapy. But we can also do some of this stuff called stripping massage, where we do parallel tendon work. And to do this, I'm going to take the muscle from a shortened position and bring it into a stretched position while I'm putting pressure on the tendon. So this is called a pin and stretch technique. And I need to have just a little more range here, so I want you to slide toward me a little bit. Just like that way, a little more. Good. Put your arm out on this. And the reason I'm going to do this is because I'm going to straighten the elbow and then flex the wrist. That's how I maximally stretch the wrist extensor. So I can do it actively and passively, but I'm going to do it passively first. So you just relax. Now the other thing I want to do is take a tissue pull. Now notice what happens. If I take a tissue pull in this direction, I end up just stretching the skin in this process. I'm going to take a tissue pull in this direction. So this is kind of backwards from everything we've ever done before for adjusting stuff. Because now when I put pressure on the muscle, I'm sliding on the muscle, I'm not stretching the skin. You see what's going on there? Okay. So I'm taking a tissue pull, if it's to say accurately, from proximal to distal before I make my contact. Now, what do we say about the thumb? This is not meant to be a weight-bearing joint. And so what can you do? I can make the exact same contact with a Graston instrument and do the same thing. I start in from a shortened position. So to shorten the muscle maximally. I make my contact just distal to the part of the tendon that's irritated or inflamed or degenerative, or to a trigger point location, so it could be anywhere along the forearm in this process. And I extend the elbow, and then I extend the wrist.